Hi, my name is Amanda Sills, and we're going to be talking about acid-base balance. The major chemicals you have to remember are bicarbonate, hydrogen, and carbon dioxide. First, let's look at bicarbonate, or bicarb. Is that an acid or a base? Base. Bubba bicarb is a Bubba base, and it's the only base that we talk about. So that means hydrogen must be an acid. Hydrogen is an acid. What about CO2? Acid. Some of you may be thinking, how can CO2 be an acid? It's a gas. Well, it mixes with water in the body and it becomes carbonic acid. So when you see CO2, I want you to think carbonic acid. Don't worry about O2 right now. The only thing O2 will tell you about the client is whether they are hypoxic or not, which is important, but not right now while we're talking about acid-base balance. The major lung chemical is CO2, which is an acid. The major kidney chemicals are bicarb and hydrogen. These chemicals will either make a person sick or help them to compensate. It depends on the imbalance that they have. Now let's look at another term, the pH. What does the pH tell you about the blood? The pH tells you whether the blood is acidic, alkaline, or neutral. And what is the normal range for arterial blood pH? 7.35 to 7.45. The body works very hard to keep this number within specific limits. Look at me for a minute. You know that every solution has a pH, right? Yes. Water has a pH of about 7, but do you know the pH of a Coke? 3. That's very acidic. That's why they tell you to pour your leftover Coke or soda down the drain to keep it open. Now let's see who thinks twice before buying a soda next time. Since the pH is 7.35 to 7.45, what is it called if the blood pH falls below 7.35? Acidosis. Yes, it's a condition called acidosis. Is acidosis a serious problem? Yes, it's a very serious problem. A person can go into a coma and die. So what if the blood pH rises above 7.45? That's called alkalosis. Right. Alkalosis makes the nervous system to become very excited, which can lead to convulsions and death. So do we agree that when the pH is messed up, it can be very, very dangerous? Yes. To make it easy, just remember, the brain does not like it when the pH is messed up. So you can see why it's so important for the body to keep such a tight control over the pH. We always want to make the brain happy, right? Yes. Let's look at what goes on in the body on a daily basis to keep the pH within normal limits. You know, at Hearst, we emphasize the normal first. So if you're a healthy person, then your body's constantly working to keep those acids and bases balanced. The key here is balance. So when a healthy person or a person who's not sick, do they still produce acids and bases? Yes. We ingest foods and beverages that break down to acids, like lemon juice and coffee. We also ingest alkaline materials, like milk and antacids. You know, we tell renal clients to eat foods that cause their urine to be more acidic or more alkaline, right? But the primary way that you produce these chemicals is through our metabolic processes. Let's say that you're a runner, or maybe just a fast walker. You've been walking around for about 20 minutes, your heart rate's up, you're burning sugars and fats. And you know what fats break down to? Ketones. And what are ketones? An acid. So, what will your body do to get rid of these ketones or acid? Increase the respiratory rate. Yes, to blow off that excess CO2 acid. Think about all the things our body will do to keep us functioning and balanced. Digesting food, walking around, breathing, heart beating, anything that requires energy breaks down into acids. So the most important thing I want you to remember is the body is constantly working to help us maintain balance. So, how does the body keep the pH within normal range? Well, let's focus on the kidneys first. Now, you know your kidneys cannot exhale CO2, okay? It just can't happen. So, how do your kidneys remove acids? Through the urine. Yes, our kidneys will excrete excess hydrogen ions in the urine and retain those ions if the body needs more acid. Now, what about bicarb? The kidneys control bicarb in the same way. The kidneys either hold on to the bicarb and return it back to the blood, or they excrete it through the urine. Now, our kidneys are slow, and they may take hours to days to begin this process, but they are very good at their job. They're very efficient. So remember, the kidneys are slow but efficient. Now, let's look at the lungs. There's only one way to get rid of carbon dioxide, or CO2. What is it? Exhale. So, do we agree that increasing or decreasing the respiratory rate will alter the amount of CO2 in the body? Yes. When a person's respiratory rate decreases, hypoventilation occurs, and the body starts retaining what? CO2. When the respiratory rate increases, that's hyperventilation, the body is eliminating what? CO2. Do you think that the lungs' response is fast or slow like the kidneys? It's fast. Yes, the lungs are a very quick process. They take seconds to minutes, but they're not as efficient as the kidneys. They're a quick fix, so to speak. Now, as you remember, the body has other buffer systems that assist the lungs and the kidneys to restore balance. But for NCLEX purposes, we're going to focus on the lungs and kidneys. So, let's review. What are the 3 chemicals that we are worried about? Bicarb, hydrogen, and CO2. If any of these chemicals become imbalanced, what 2 things will happen? The person will become sick, and the person's body will try to fix the problem, or in other words, compensate. Now, the first acid-base imbalance we're going to talk about is respiratory acidosis. Respiratory acidosis can be acute or it can be chronic. Let's look first at the pathophysiology. So which organ has a problem? The lungs or kidneys? Lungs, because it's respiratory acidosis. Since the client has a lung problem, what chemical is causing the problem? CO2. If it is a lung problem, it can only be CO2. CO2 is the only chemical that the lungs control. And since this client is in acidosis, do we have too much or too little of this chemical in the body? Too much. That's right. They are retaining too much CO2. Since this client is retaining too much CO2, are they hypoventilating or hyperventilating? They are hypoventilating. In other words, they are breathing way too slow. And since they're breathing way too slow, they are retaining CO2, and that's an acid. You see, the problem started with the lungs, and they cannot fix themselves. Another organ must help fix the problem. So which organ will help the body fix this problem or compensate? The kidneys. The kidneys are going to compensate. How? What are the 2 chemicals the kidneys have available? Bicarb and hydrogen. In acidosis, the body is trying to become less acid, so the body must excrete the acid. In other words, get rid of hydrogen. Remove it from the body because hydrogen is the acid that the kidneys control. The body will secrete bicarb into the blood because bicarb is a base. If you put bicarb or any base into an acid solution, that solution is going to become less acid. The whole purpose of compensation is to make this person less acid and return them to a balanced state. Now, is the pH high or low? Since we're talking about acidosis, you know the pH has got to be low. So, let's just stop right there and recap for a second. In respiratory acidosis, which organ is sick? The lungs, so the problem chemical is CO2. The only way someone can have respiratory acidosis is when they're not breathing correctly. In other words, they are hypoventilating. So, if the lungs are sick, which organ is left to fix the problem? The kidneys. How? By excreting hydrogen and retaining bicarb. Now, let's look at some causes of respiratory acidosis. When is a person likely to retain CO2? Let's pretend I'm fresh post-op. I have a big mid-abdominal incision. Am I going to take nice deep breaths just because you tell me to? No. Why? Because it hurts. Therefore, I'm retaining CO2. I'm hurting very badly, let's say, so I ask for morphine. Or maybe I can't sleep, so I want a sleeping pill. You see, both narcotics and sedatives will depress your respirations and cause you to retain CO2. What if you have a client with a pneumothorax, a collapsed lung? Are they breathing properly? Of course not. Therefore, they are retaining CO2. What if you had a client with pneumonia and they had lots of thick, sticky secretions in their lungs? Do they have good gas exchange? No. Therefore, they're retaining CO2. In all of these lung problems we've just discussed, the common denominator is hypoventilation, thus impaired gas exchange. All will lead to acidosis. Let's look at some signs and symptoms now. Initially, this client may complain of a headache. They may be confused. They may appear to be sleepy, because as the CO2 continues to build up, they get even more sleepy, so they're much harder to arouse. If this problem is not corrected, they will go into a coma. As the acid concentration increases, the level of consciousness goes down. Think about this. If the CO2 level is very high, the client's oxygen level in their blood must be low. Therefore, the client is also hypoxic. When someone is hypoxic, what do you give them? Oxygen. All right, now this person has two problems. They're hypoxic and they have high levels of CO2. Now, what are the two earliest signs of hypoxia? Restlessness and tachycardia. If you have a client developing respiratory acidosis, you could identify this problem early by recognizing restlessness. So, on the NCLEX, whenever you see restlessness, I want you to think hypoxia first. Now, let's talk about some treatment for the client in respiratory acidosis. We've got to fix the breathing problem. The client will not improve until the breathing is fixed. If you have a client with pneumonia, the treatment is directed at resolving the pneumonia. Treatment is directed at helping to rid the client of all the secretions in their lungs, which will have a positive effect and it will improve their breathing. Now, we've listed some interventions in your book, so let's take a look at them. The client may require postural drainage, percussion and vibration therapy to loosen all those secretions, deep breathing exercises, suctioning to remove those secretions, fluids to liquefy those secretions so the client can cough and remove them, elevate the head of the bed so they can expand their lungs better, and incentive spirometry to help expand those lungs. If you have a client that has a pneumothorax, they're going to have chest tubes. So, encourage post-op clients to turn, cough, and deep breathe. If you help prevent pneumonia, you will help prevent respiratory acidosis as well. You see, we focus on lots of respiratory interventions that will help our clients reach their ultimate goal, to maintain adequate breathing and good gas exchange, therefore preventing respiratory acidosis. Now let's talk about respiratory alkalosis. Look at the pathophysiology with me. Which organ has a problem, the lungs or the kidneys? It's got to be the lungs because the name of the imbalance is respiratory alkalosis. So, which organ will work to help fix the problem or compensate? The kidneys. If the lungs are sick, they cannot fix themselves, so the kidneys are going to compensate with two chemicals. What are they? Bicarb and hydrogen. Now, let's talk about what the kidneys will do with the chemicals they have available, bicarb and hydrogen. Remember, this client is alkalotic, so they have too much base. So, the kidneys will start excreting bicarb and retain hydrogen because it's an acid. The goal of this compensation is to make the client less alkaline and return the pH to normal. Well, since this client has a lung problem, what chemical is causing the problem? CO2. Since the client is alkalotic, are they gaining or losing too much CO2? Losing. Since the client is losing CO2, they are hypoventilating or hyperventilating. Hyperventilating. Yes, the only way to get rid of excess CO2 is to hyperventilate. The client is breathing too fast. What do you expect their pH to be? High or low? Well, we're talking about alkalosis here, so the pH must be too high. Now, let's recap respiratory alkalosis. If someone has respiratory alkalosis, you know they have to have a lung problem, and the problem chemical is CO2. This means the client is breathing too fast, so they're hyperventilating, therefore getting rid of too much CO2 acid, so this client is alkaline, And you know, the more alkaline, the more the pH goes up. Since this is a lung problem, which organ will fix the problem? The kidneys. Can the kidneys do this quickly? No. Remember, the kidneys are slow but efficient. Now, let's look at some causes of respiratory alkalosis. The first clue to make you think of this problem is hyperventilation. Yes, hyperventilation. And this client may become hysterical. Maybe you have a family member or visitor that becomes hysterical in the hospital. Anyone who is breathing way too fast is getting rid of CO2. Also, anyone who has an acute aspirin overdose, this person will enter the emergency room breathing too fast because initially during an aspirin overdose, it stimulates the respiratory center. Therefore, the client will be hyperventilating. The bottom line in both of these situations is the client is breathing too fast and therefore removing CO2. CO2 is acid, therefore they're losing acid in their body because their lungs are involved and they are not breathing properly. You will see in your book, it says situation, hysterical client. Let's talk about it. Let's say you're a triage nurse. You're working in the ER and you're driving to work one night because you've got that brand new nurse shift, that 7P to 7A, and you're driving to work at 6 p.m. at night and you're looking around and you see a bunch of limos, okay? And what are sitting out of the top of the limos but glitter and hairspray? So you know it's prom night. And you arrive at work and around 11 o'clock, Johnny shows up in the ER. Johnny fell out of the top of the limousine, okay? And Johnny's going to be just fine. But now the kids get wind of this, so where has prom moved to? The ER. And there's this one little girl in the back, and she's just so upset. She's getting all anxious, she's breathing hard, and then all of a sudden, boom, she passes out. What do? Stand back. The kidneys are going to kick in. No. Okay? How long does that take? Hours to days. So let's look at what happened here. Let's look at signs and symptoms. Acute respiratory alkalosis causes vasoconstriction of the cerebral vessels. So now the person becomes lightheaded. They could faint. The client may also have some abnormal sensations like perioral numbness around the mouth, numbness, tingling in the fingers and toes. So let's look at the treatment. Again, we're not going to wait for the kidneys to kick in. So what you can do before someone faints is ask them to breathe into a paper bag. Now, while you're waiting on the paper bag, you try to calm the girl down. Slow down the breathing. Ask her to breathe with you, okay? Breathing into a paper bag will force this client to take back their CO2. Some people become so anxious, they may have to be sedated to decrease their respiratory rate. Treat the cause. Determine why the client is breathing fast. We're going to monitor those ABGs, and before we move on, I want to emphasize something. It doesn't matter if it's respiratory acidosis or respiratory alkalosis. The main problem is respiratory. The problem traced back to the lungs every time. Now, let's switch gears and we're going to discuss metabolic acidosis. Let's look at the physiology first. Metabolic problems are a little more complicated, but they can still be easily understood, so let's just take it slow. In metabolic acidosis, which organ is sick, the lungs or kidneys? Kidneys are sick. Which organ will help the body fix the problem or compensate? The lungs will compensate. With what chemical? CO2. The lungs only have one available chemical to use for compensation. What is it? CO2. Since the client is having kidney problems, which chemicals are causing the problem? Bicarb and hydrogen. What is happening with these chemicals? Remember, we're talking about acidosis. They are retaining too much hydrogen, which is an acid, and they're excreting too much bicarb, which is a base. Those are the problem chemicals. Remember, the compensating chemical is CO2. And since we're in acidosis, do you expect the pH to be high or low? Low. So, do you expect the client's respiratory rate to increase or decrease? Increase, to get rid of all that acid. So let's recap. We're talking about metabolic acidosis, and we know that it's a kidney problem. So, since it's a kidney problem, two problem chemicals exist, bicarb and hydrogen. So, which organ will compensate? The lungs will compensate. The lungs only have one chemical available, and it is CO2. And CO2 is an acid. How are the lungs going to get rid of acid? They're going to do what to the respiratory rate? Increase it. Yes. Now let's look at some causes. There are many different causes, but we always want to blame it on the kidneys. We know it's not always the kidneys' fault. Let's look at some examples. Diabetic ketoacidosis and starvation. Let's explore these. It doesn't matter which one the client has, DKA or starvation. Basically, the pathophysiology is the same. Let me explain. With either situation, the cells are starving for glucose. They need that glucose for energy. So, the cells look for other energy sources. The body will start breaking down protein and fat. And when fat is broken down, what do you produce? Ketones. And ketones are acids. So, if I decided to starve myself and I lost 5 pounds really quickly, I'm going to start breaking down body fat. And when I break down body fat, I produce ketones. And ketones are an acid, so the acid level will go up in the blood. We haven't said anything about the lungs yet, so that's how you know it's not a respiratory problem, so it must be a metabolic problem. So, as the acid level increases in the blood, what happens to my blood pH level? It goes down. Since this is a metabolic problem, the lungs are going to compensate. The lungs only have one chemical available for compensation, and that chemical is CO2. Therefore, as my respiratory rate increases, my lungs are helping remove the extra CO2, and I become less acidic. All right, let's do a critical thinking exercise. Let's think about the client with diabetic ketoacidosis. Their blood sugar is very, very high. High blood sugar is what got them into trouble to begin with, right? Right. The cells want this sugar, but since we're talking about DKA, does the client have insulin to transport the sugar from the blood to the cell? No. So this client will begin breaking down body fat for energy, and the result will be a buildup of ketones, and ketones are acids. So now the client is acidotic. And this is a metabolic acidosis, so the lungs will try to fix the problem by increasing the rate and depth of respiration in an effort to remove the extra acid. And if you're a diabetic who is in DKA, what do we call this increase in respirations? Kussmaul respirations. Their body is forcing them to exhale CO2, so they will become less acidic. Now let's look at some other causes of metabolic acidosis: renal failure and severe diarrhea. Let's look at renal failure first. When the kidneys are failing, they are no longer effective in filtering out acids or retaining base, right? Right. And in severe diarrhea, the lower GI contains a lot of bicarb, which is a base. So, if a client is having severe diarrhea, they're losing base from their body. If excess base is lost, what remains behind? Acid. Once again, we haven't said anything about the lungs, so this suggests that it's a metabolic problem. Let's look at some signs and symptoms of metabolic acidosis. The symptoms depend on the cause. If the client is in diabetic ketoacidosis, you would think about the signs and symptoms that go with DKA. If the client has problems with nutrition, starvation, anorexia, bulimia, think about starvation symptoms that go with these nutritional problems. Additional signs and symptoms include hyperkalemia, so we need to be watching for muscle twitching, muscle weakness, flaccid paralysis, and finally, those arrhythmias. Remember, we talked about these symptoms earlier with hyperkalemia and the electrolyte section. Another symptom you should monitor for is an increased respiratory rate, because what is the client trying to blow off? CO2. Okay, now let's focus on treatment for metabolic acidosis. Treat the problem, the cause of metabolic acidosis. If you have a client with DKA, you must treat the DKA, but that's another lecture. If you're talking about a client with anorexia or bulimia or someone who is poorly nourished, we would see another group of symptoms. But there are some basic things that we can do. One thing you can do for the client who has metabolic acidosis is to give them IV push sodium bicarb. If you give IV push bicarb, is that going to fix the problem? No. It's not going to fix the cause, therefore it cannot fix the problem. It will, however, buy you some time until they figure out what's causing the metabolic acidosis. If the client is in DKA, the treatment will be directed at bringing the blood sugar down. Thus, treating the DKA will correct the acidosis. Now let's look at metabolic alkalosis, our last acid-base imbalance. Let's look at the pathophysiology first. Which organ has a problem, the lung or the kidneys? The kidneys. So, which organ will compensate? The lungs. With what chemical? CO2. Since this is a kidney problem, which chemicals are causing the problem? Bicarb and hydrogen. What is happening with these chemicals? Remember, this client has alkalosis. They have too much base, so they are retaining too much bicarb, and they're excreting too much hydrogen. So they're losing too much acid and they're retaining too much base. So tell me, is their pH high or low? Well, since we're talking about alkalosis, the pH must be too high. The more alkaline, the higher the pH will go. Okay, let's recap. Metabolic alkalosis. Is this a lung problem or a kidney problem? Kidney. So what are the problem chemicals? Bicarb and hydrogen. What organ is going to compensate? The lungs. The lungs only have one chemical available for compensation, and that is CO2. In this case, we have a client who is too alkaline, so the pH is going to go up. Therefore, the client's respiratory rate must go down in an effort to retain acid, thus increasing their CO2. So let's look at some causes. The first cause we're going to look at is loss of upper GI contents, like with vomiting or GI secretions that are lost through an NG tube that's connected to suction. With both, the client is losing acid from their body. And if acid is lost, what is left behind? Base. What if a person ingests too many antacids? Well, they're ingesting too much base. Could we give them too much IV bicarb in a code situation and cause the person to become alkalotic? Yes. So let's look at some signs and symptoms of metabolic alkalosis. The signs and symptoms, remember, will depend on the cause. Expect to observe alterations in the client's level of consciousness. Another thing you need to consider, what is your client's potassium level going to do? The serum potassium level will go up in metabolic acidosis. So the serum potassium level will go down in metabolic alkalosis. So if you have a client who is hypokalemic, you should be cautiously monitoring for muscle cramps and life-threatening arrhythmias. Now, treatment. What caused the client to go into metabolic alkalosis? The treatment will be directed towards the cause. In other words, we've got to fix the problem. Another treatment will be to replace that potassium, since the client will be hypokalemic. Okay, now we've just looked at how clients with acid-base imbalances will present clinically. So our next job will be to interpret the lab values. You see, the NCLEX lady may give you a set of lab values and see if you can determine what's going on with the client. If you can't look at these lab values and understand what's going on with the client, then you will never get these questions right. But guess what? We're going to make a game out of it. So let's get started. Now, look at the lab values we've given you on the screen. They're the same lab values that we've provided in your book. pH, 7.32, CO2, 41, and bicarb, 20. Now, the first thing you will always look at is the pH. And what's a normal pH? 7.35 to 7.45. If the pH is less than 7.35, remember we call that acidosis. If the pH is greater than 7.45, we call that alkalosis. In our problem, the client has a pH of 7.32. Is that acidotic or alkalotic? Acidotic. Your diagram should now look like the diagram on your screen. The second lab value you're going to look at is CO2. CO2 is your respiratory component. And what's a normal CO2? 35 to 45. If you have trouble remembering these numbers and you get your CO2 and bicarb values confused, simply remember that the pH and CO2 are closely related. So if you cover up the 7s in the normal pH range, what do you have? 35 to 45, your normal CO2 value. Now, is CO2 an acid or a base? It's an acid. So if you have a PCO2 value more than 45, you know you have too much acid. If the PCO2 value is less than 35, you know there's not enough acid. Therefore, what are you left with? Base. In our problem, is the CO2 normal? Yes. Since the PCO2 is normal, we know that which organ is not involved? The lungs. Remember, the lungs will increase or decrease respirations to remove or keep the appropriate amount of CO2. Your diagram on your paper should now resemble the diagram on the screen. Lastly, look at bicarb. This is the metabolic component. What is a normal bicarb? 22 to 26. And we know that bicarb is an acid or a base. Bubba bicarb is a bubba base. So if the bicarb is less than 22, there's not enough base, so you are left with acid. The client's acidotic. If the bicarb is greater than 26, there's too much base, so the client will be alkalotic. In our problem, is the bicarb normal? No, it's too low. If our bubba bicarb, which is a bubba base, is too low, then the client must be acidotic. Now your diagram should be complete, and it should resemble the one on the screen. In looking at these values now, we see that the bicarb is abnormal, so what's the problem area? Respiratory or metabolic? Metabolic. Bicarb is the metabolic component, so yes, it's metabolic. What did we say the pH was? Acidosis or alkalosis? Acidosis. So we have metabolic acidosis. Now give me 3 examples of metabolic acidosis that we previously discussed. DKA, diarrhea, and renal failure. Now take a look at your next set of ABGs. First, look at the pH. Is that a normal pH? No. What's the imbalance? Acidosis or alkalosis? Alkalosis. Next, look at the respiratory component, the PCO2. Is the PCO2 normal? No, it's too low. And CO2 is an acid or base? It's an acid. So since our acid is too low, we are left with base. So now we're alkalotic. Let's look at bicarb. Is that normal? Yes, it's normal. So according to the pH, the client is in alkalosis. Is it respiratory or metabolic? Respiratory. The PCO2 is messed up, so it's respiratory alkalosis. This client must have been breathing too fast or too slow. Too fast. Remember, the hyperventilation scenario? That's what's happening with this client. Your chart should now look like the one on your screen. Now let's take a look at compensation. We just discussed that if you stay in these acid-base imbalances long enough, your body will try to fix the problem. It will try to compensate. If the client has partially compensated, the pH will be abnormal. The pH will be normal if the client is fully compensated. The main giveaway that compensation is present, whether it's partial or fully compensated, is that both the PCO2 and bicarb will be abnormal. So let's practice. Take a look at the arterial blood gases on the screen. First, look at the pH. Is it normal? No, it's acidotic. Now look at PCO2. Is that normal? No, it's acidotic. Lastly, look at bicarb. Is that normal? No, it's alkalotic. Since both the PCO2 and bicarb are abnormal, we know the client is compensating. Since both values are abnormal, you must find the value that matches the pH in order to figure out which acid-base imbalance the client is in. In this problem, the PCO2 matches the pH because they are both acidotic. So this is a respiratory problem. This client is in respiratory acidosis with partial compensation because the pH is still abnormal. Now, does your graph look like ours? Let's do one more. Again, first look at the pH. Is it normal? Yes. Now look at the PCO2. Is it normal? No. It's acidotic. Lastly, look at that bicarb. Is it normal? No, it's alkalotic. Since both the PCO2 and bicarb are abnormal, we know the client is compensating. However, the pH is normal, so we know this client has partially compensated or fully compensated. Fully compensated. Since both the PCO2 and bicarb values are abnormal, you must find the value that matches the pH in order to figure out which acid-base imbalance the client was in. In this problem, the pH is 7.45, which is normal, but it's on the alkalotic side of normal. You see, anything greater than 7.4 will be on the alkalotic side of normal, and anything less than 7.4 will be on the acidotic side of normal. So, which value matches an alkalotic pH? Bicarb. The bicarb is 35, and that's alkalotic. So, this is a respiratory or metabolic problem. It's a metabolic problem because bicarb is a metabolic chemical. So, this client is in fully compensated metabolic alkalosis. Is this what your chart looks like? If so, that's great. But if you need more practice, go to our 5th day materials. We have more examples there for you to interpret. Okay, that's the end of our discussion on acid-base balance.